and ask, and you can get as specific as you want. If he can't answer, he'll use those three magic words. I don't know, but
And if I do use those magic words, I do want to get your contact information because, again, I'm that nerd, that inner child that likes to come out that I will research and answer and I will get back to you.
yeah, excellent. All right. Anyone has anything? Go ahead and speak up.
Hi.
Cassandra, hi.
Dave, I don't know if you remember me, but we were roommates once upon a
Cassie,
time. Yeah.
oh my God. How are
I'm
you
so proud
doing?
of you. I'm good. I'm so proud of you. I've been enjoying watching you rock and roll.
Thank you very much. Oh my God, you look great. You came across my feed several months ago and I thought about reaching out. Anyway, let's connect after this. Do you have a question for Dr. Scott?
Oh yeah, I definitely do. So my mom has Parkinson's disease and she's had it since I was 6 years old. So it's 32 years that she's had Parkinson's disease. I'm wondering if you have any thoughts on the root cause of Parkinson's disease, because there's a lot going on in that field right now in regards to.
Yeah. Yeah. So root causes of Parkinson's. I mean, and how old was if you don't mind me asking, how old was your mother when she was diagnosed with Parkinson's?
She was, I believe, 30.
Okay. And do you know if there's any genetic predisposition or genetic line of Parkinson's?
No, but we do have a history of my aunt was hit on the head by a abusive boyfriend, and she developed epilepsy.
Okay.
So like I think there's a history of when a trauma happens, like it will spark that kind of response.
Yes, yeah. And so as for root causes, I mean, a lot of times when it's related to Parkinson, it's typically looking at dopamine.
Right.
Dopamine is being a big causative agent there and the substantia nigra of the brain, so on and so forth. And you can Google search and I'm sure they'll give you a very good explanation there. But so with Parkinson's, um, there are the firing of the brain and what's happening there and this spatial awareness of things. Um, Ways that we would assess it now and ways that things that I would do, in her case would be assessing, what is she putting in that could be adding additional inflammation.
Mm,
Whether, like I was mentioning with the food sensitivity testing, is there additional inflammatory sources that are going in through the diet that are quote unquote good foods, but just don't agree with her? I would look at neurotransmitter panels. I would look at,
mm,
and they're done through urinary metabolites. I would look at, serotonin, dopamine, their relationship, as well as acetylcholine and GABA, and trying to make a better assessment of where there may be a dysfunction there. Other things of consideration for treatment wise, things of consideration maybe for you to do some more research into would be looking at NAD. So N is in Nancy, A is in alpha, D is in dog. NAD stands for nicotinamide adenine dinucleotide, bit fancy word for one of the drivers of the mitochondria, something called the electron transport chain, and that will help too. I've used that with some of my more Parkinsonian type patients, as well as muscular MS patients, and I've
mhm.
even used it for my Alzheimer's patients, and that's phenomenal and it really will help make some changes and get a little bit more quality of life back. Obviously, once the Parkinson's has presented, and that's why I was trying to understand the genetics and that maybe even epigenetics, your grandmother or even great grandmother, things that maybe have happened in the lineage there that can be passed through in the epigenetic side of things. That's something. But once it's triggered and presented, um, it's there. We know that, but and it's really we're all born with what we're going to have. When we're born, we have the predispositions. Whether it presents itself or not, that's what it's our choice, so to speak. What we're exposed to, what we bring in, and so on and so forth.
I will definitely look up. Well, that was a lot, but I will definitely look up the NAD Do you have any specific advice on, I mean, with dopamine deficiencies, sugar addiction is a really big issue for my mom because, like that's one of the very, very, very few ways in which she can get pleasure, in which her body is capable of making pleasure. Um, I mean, personally, like I have my theories about my mom's root cause of the Parkinson's disease. I do think partially it's, due to generational trauma and pain addiction. Um, but do you have any advice on how we can get her off of the sugar, but still, you know, replace it with some pleasurable things so that it's not such a, because, there's just such few pleasurable stimuluses in her life.
Mhm. Yeah, and so for her, we'll start with the sugar side of things, kind of removing the sugar aspect of things. First and foremost, there's a very phenomenal natural source of there's a product called berberine. Berberine's a plant source. Berberine is a very good way to help manage or metabolize glucose. They've
Okay.
done head-to-head studies with that in metformin, and you see some very good benefits of berberine. So look into that one for the blood sugar. Now, a lot of patients that are my sugar addicts. I know David likes to listen up here too on that. So any of our sugar people, the ways that you can trick your body of thinking that you got glucose, but you didn't really get glucose is using amino acids, branched chain amino
Mm,
acids. So, and if you have ever been exercising and you feel like you're starting to crash in energy and focus, and if you were to put amino acids in, it brings it right back up online. So that's a really good trick to do. I typically recommend patients that may wake up in the middle of the night and go raid the fridge for something sweet. Instead of doing that, keep your amino acids next to your bed and use that, and you can go back to sleep. So it's a very good way to trick the system. Um, and So that's the sugar side of things. As for the pleasure side of things, that's where I would want to look at I would recommend finding a functional medicine doctor or a doctor that can run those neurotransmitter panels and looking at serotonin as comparison to the dopamine
mm,
and seeing what those look like because serotonin is the happy neurotransmitter, the one that's going to give you joy, um,
yeah.
and where it's mostly made in the gut. 75% of your serotonin is made here. So if you have poor
Mhm.
digestion, there's going to be some issues along the line with depression and mental side of things there too.
That's really, really helpful. Thank you. She does have really hard time sleeping, and it would make sense that if we address the serotonin, it would help with it. Thank you.
You're welcome. Yeah.
I have a question.
All
Hey,
right.
Dr.
Hello,
Scott.
Miss Rachel.
Hello, hello. So I have actually a couple, if you don't mind, if I can just, hopefully they'll probably be pretty short answers for you, but long-term estrogen dominant. I know my daughter has had that. She's trying in the process of trying to get pregnant and you know what's been happening. But I just think about that long-term, she's been estrogen dominant, I think since she was 18 and lost her ovary.
Mhm.
What are some of the, I know that's not a good thing and it can, produce cancers and different things like that. So for long term for her, I just think about, like, it makes me nervous. It scares me. I worry about her. I kind of try to think, is there something outside of medicinal? Is there something in her diet maybe she should try to get away from? Is there, for long term, I
Mhm.
I don't know, like what's the best, what are the complications that could potentially happen and what are the best avenues to direct
Yeah. Yeah. I mean, and great question. I mean, estrogen dominance, we're seeing it, so frequent today, and not just in women. Unfortunately, we're seeing it in young men and guys today with gynecomastia. Um, so estrogen dominance, it's a dangerous place to be because estrogen is the leading cause to all of your feminizing type cancers. So whether it be ovarian cancer, and if she's only working on one ovary as it is right now,
that?
that's something of a concern and something to be aware of. Obviously, cervical cancer is a big factor with that too. Um, and to round it all out, the last one is breast cancer. And I see that in guys too. So breast cancer isn't just limited to women, and guys, due to the estrogen dominance, can deal with breast cancer as
Right.
well. So those are the things that are the major concerns. Obviously, weight management, difficulty with cycles while she's still cycling with estrogen, severe PMS, weight changes, difficulty with skin with estrogen dominance. The long term, you asked about would be more along the lines of osteopenia, osteoporosis. So those are the big things, big picture wise, that would be of concern. Treatment wise, diet wise, obviously, watching the phytoestrogens, the soys, those sides of the plant side for estrogen. And then, when meats are consumed or proteins are there, the best source is obviously going with, the antibiotic free, cleanest sources possible there. Um, let's see, and then obviously supplementation. There's ways to address it, and to manage it with supplementation. There's strong versions of estrogen metabolizers, and there's some weaker forms of that too. And it's not so much just estrogen itself. It's what does estrogen look like in its counterpart or its counterbalance of progesterone.
Hmm. Yeah, good. Really good stuff. Thank you for all of that.
Absolutely.
And then just for myself, just what's a good option for memory boosting? I'm not getting any younger, so I think about my mom actually passed away from dementia. It's always in the back of my mind. I mean, I think I'm pretty sharp, but
Yeah, yeah, yeah. No,
help me out here, Doc.
I recommend that I recommend this for just about everybody. I mean, because as we start getting into our or going through our older years, and we start seeing that we can't remember, we have word soup, or we have brain fog, or whatever the case
Mm.
may be. um Yeah, it's definitely important to look at, supplement wise, or yeah, nutraceutical wise, we'd be looking at things like phosphatidylserine. It's an amino acid as well. That's a very big benefit for brain focus and cognitive function. There's another supplement that's called Huperzine A, that's very good for brain function and memory as well. I always recommend uh, obviously brain games and Sudokus and things like that to always keep your mind fresh and keep, critical thinking skills there. And then the last thing that I use, and I used to use this pretty often in an IV regimen for a lot of patients, but currently I've been using it and recommending it through a nasal spray, and it's a product called NAD, just like I was mentioning to Cassandra. NAD, nicotinamide adenine dinucleotide, and its properties and its benefits with the mitochondria. But it's also, I've seen the uses and the success with my Alzheimer's patients. I just quick story. I had a lady, a patient came in, and she was in her late 70s, early 80s, and I did the typical Alzheimer's questionnaire form, and she couldn't really fill it out. She didn't know what day it was. She couldn't write a sentence. There was so many things, and I we ran a course of NAD infusions for her, and she came back in after an 8-week infusion plan, and we did that same questionnaire. She could write her name, she could tell me what day it was, where she was, she wrote a complete sentence, everything. Everybody in this facility is so nice, and she was a completely different woman, and so I do highly believe in NAD as a benefit for brain function as well.
Awesome. Thank you.
Yeah, you're welcome.
I have a question.
Yes. Hi, Katie.
Um, Hi. So I have a couple questions, but my first one is um, I was taking an iron supplement and I did all this research on it and picked the brand based on like researching the company and like what's it made of and how everything interacts and absorbs and stuff. But when I do that, I like once I do it, then I trust my research and I kind of forget. And this company stopped making the supplement. And so I needed a new iron supplement, and I'm in that like frozen place where like now I need to go do the research and I just keep not ordering it. So, what can you tell me about like what does an iron supplement need to have in order to best absorb in the body?
Yeah, so I'm glad you asked that because I mean you probably have seen this with other supplements too, that you'll see like there's a fumarate and a gluconate and there's all these different eights attached to it, right? So those are the chelate forms or the salts that it's bound to, whatever you want to call it. Um, and so when you look at those, they all have different strengths with them. Some are 325 milligrams, some are 50 mil or 500 milligrams. And when you start looking at some of the different sources of the iron, you'll see that there's a lot more potential for constipation. And that's one of the major issues with iron.
Mm.
When I recommend iron, I typically lean more towards a ferrous bisglycinate. So BYSGLYCINATE. So ferrous bisglycinate. You can take that at a much lower dose. I want to say it starts around 27 milligrams. So it's a much lower dose, but the effectiveness is so much better, and you don't have the constipation issues from it. So
Oh,
that's where I would kind of maybe steer you towards that. But what should be in it? Obviously, ferrous should be in it. Ideally, that would be the only thing that you would want to be in it in that product, depending on what which form you went with. I just typically I always lean towards the bisglycinated form.
what is ferrous?
Ferrous is iron.
Oh,
So when you look at the periodic table, iron comes up as an Fe.
oh, got it. Okay.
Yeah.
Um, and okay, so thank you
Yeah.
for that. And then I also had a question about, so you mentioned adrenals earlier,
Mhm.
and hear people talk about adrenal health and stuff, but I don't ever understand exactly what adrenal health is or what that means. Can you explain that a
Yeah.
little bit?
Yes, and thank you for bringing that into this conversation tonight, because I think that the adrenal glands are often overlooked and missed. There's so many doctors that are just, unless you have Cushing's or Addison's disease, they're not looking at your adrenal glands. And those are the two major disease states that come from the adrenals. Obviously, pheochromocytoma, but that's a different story altogether. But adrenal fatigue, adrenal dysfunction, adrenal exhaustion all kind of one and the same. And what the adrenal glands are, for those in the crowd that aren't aware, they're triangular shaped glands that sit on top of the kidneys. They're responsible for your fight or flight response. So when stress comes in, or let's just say grizzly bear comes in the room, the adrenal glands are going to fire. The body doesn't understand the difference between a grizzly bear and everyday family, financial stress, whatever. It's the same thing. The body's going to respond the same thing, the same way. So what it does is it sends epinephrine, norepinephrine to the brain and says, "Hey, Katie, get away from the grizzly bear." So, and that's going to create a hormone called cortisol. And I'm sure you've heard of cortisol. Cortisol is that, it's necessary to keep you safe and away from the grizzly bear, but cortisol in excess loves to set up shop around the midsection. So you see a lot of people that gain weight and they're like, I can't change this. I can't get rid of this midsection. Often it's cortisol weight that's coming from that, and that's from the adrenal glands. So as cortisol stays in that high area, you run into the diagnosis of adrenal fatigue or adrenal exhaustion. So the questions related to the adrenal glands, if you want to know if you fall into that category, do you have sensitivity to the sunlight when you go from inside a building to outside? Do you feel like you got to shield your eyes or put on sunglasses? Do you have sensitivity to the headlights when you drive at night? Do you get lightheaded or dizzy when you move from lying down to standing? Do you crave salt? Do you have afternoon crashes between 1 and 3 o'clock? If you answered yes to any of those questions, there's some adrenal dysfunction happening there. So you definitely want to start looking at what's happening with the adrenal glands, and that's by measuring cortisol. Cortisol is best measured before 10 o'clock in the morning because it does have its typical arc that it drops throughout the day. So with the adrenal glands, they're very resilient glands, and but they do get exhausted over years of stress or higher stress. And once they get exhausted, they can take anywhere from 9 months to 24 months to get them back on track. Ways to get them back on track is using adaptogens. So you've probably heard of, adaptogens like the mushrooms like cordyceps, reishi. I'm sure you've heard of Erythrococcus cinereus. Those are all adaptogenic type mushrooms that will work with either the upregulation or downregulation of the adrenal complex.
Maca is an adaptogen, correct?
Maca is, yes.
Okay. All right, cool. Thank you.
Yeah, you're welcome.
It looks like there's a question in the comments or in the
Oh,
chat.
I don't see comments. Oh, there it
Michael,
is. I see
yeah.
it. All right. How is the modern Western diet affecting our hormones? Oh, okay. So how is the modern Western diet affecting our hormones? So yeah, I mean, just like we were talking about, earlier with the fast food nation and what we're putting in and really a lot of the stuff that we're consuming today isn't really foods and a lot of it's made and processed and there's GMO and there's endocrine disruptors. So when we're talking about hormones, that's the endocrine system. And when we have those food sources or that diet in place, and we have high inflammation scales and high fat content, and we have high cholesterol and high sodium. I mean, why do we have and high sugar? Why do we have the three major things in America today? High blood pressure, diabetes. I mean, and so. And people are having difficulty losing weight too. Why is that? So I mean, Western diet, I really believe, is a major contributor, if not the underlying cause to a lot of our issues today. Yeah. And as for it relates to hormones, sorry, I didn't fully answer your question. But with the estrogen going up, it's definitely affecting, like I said, guys with gynecomastia, and as well as our women that are dealing with more of the estrogen dominance effects as well. Good question, though. Thank you.
Can I ask another question?
Sure.
Um, so if I understand epigenetics correctly, um, this is a question in relation to like the uptick in Alzheimer's and dementia. Um, so if it's in our like if you're born with a predisposition based on, based on your genetics, what are I think, do I understand correctly that epigenetics means like there are things that you can do that trigger that or not? So maybe I'm misunderstanding that, but I guess my question is, even if that's not what epigenetics is, what are the things that that people can, um, I guess, like either add to their lifestyle or avoid that seem to be the things that trigger Alzheimer's and dementia if that is in your genetic line?
Yeah. Yeah. So I'm gonna talk about epigenetics first, and then I'll swing back into the Alzheimer's side of things and how you can assess for things along like that, and what you can do to prevent you from really dealing with that. It's a very big topic for me. Alzheimer's is. So epigenetics is, what's been passed on through the lineage. I mean, everybody knows genetics is what's passed on from mom and dad. Epigenetics is, say you go two lines back, and let's just say hypothetically, go back to my Irish heritage and the potato famine or whatever, or fighting in the Civil War in the United States. Who knows? Who knows? So that epigenetic, that trigger has been then now stored into the DNA of my ancestors. And then when it transfers over through something called a miasm, and it can present in your potentials of what could present. Now, genetics plays a role in it, lifestyle plays a role in it, whether it's going to present itself or not. So that's the epigenetic side of things. I recently linked in with this phenomenal lab called True Diagnostics, and they're using epigenetic testing right now. And the way that they're using it is they're assessing your chronological age, what you currently are, versus your biological age, and they're looking at what the epigenetic markers that could be affecting that. And they have the second parts of that testing that can identify what you should be putting in to prevent any of these things from triggering. So to circle back to your Alzheimer's side of things, what you would want to do to look at, obviously, that epigenetic testing is good. You can run genetic tests looking at, for Alzheimer's specifically, there's something called APOE4. It falls under the cholesterol side of things, and it is one of the markers that we measure for Alzheimer's. Um, there's other, lab testings that, can see what's happening with your neurotransmitters. There's a very good lab out in California called Vibrant America that they do a lab test called a neural zoomer. And I mean, this thing looks, it turns over every rock and it looks at everywhere for what's going on and what your predispositions are, but more currently, what you need to focus your attention on.
I have a follow-on
Thank you.
for that. I've heard Alzheimer's referred to as type 3 diabetes.
Mhm.
Can you speak to that?
Yeah, that's the big thing out now is they are deeming Alzheimer's as type 3 diabetes. And with that, the major issue or the causative agent of Alzheimer's is something called beta amyloid plaquing, and that does occur in the brain. It typically affects the frontal cortex first. And so you'll start to see it kind of infiltrate there. But the reason why those beta amyloid plaques do even have a chance to present themselves is due to sugar content. So glucose, higher glucose levels when the body is doing converting, it does have the ability to cross the blood-brain barrier, is something called glutamate. Glutamate is a neurotoxin. So that is the number one causative agent, that combined with inflammation of Alzheimer's itself. And Alzheimer's, kind of going back to even what Katie was saying, it's very important to me because the research now is showing that Alzheimer's, more people are fearful of Alzheimer's than they are of cancer itself today. And that to me tells me that, we definitely need to make a change. And I think managing and regulating blood sugars is a very good step in that direction.
Yeah, thank you for that. So, what's your stance? I guess kind of related. What's your stance on the ketogenic lifestyle?
Yeah, no, I've tried all the different diets things because I want to speak from experience. So I've tried keto, I've tried paleo, I've tried all the different aspects. I do believe keto has a very good benefit to it. If you are one of those genetic predisposition for cholesterol issues and you do have a high amount of inflammation, and considering keto is typically a bit higher on the fat side of things, you want to tread lightly with it. And when I recommend keto, I don't recommend it as a complete lifestyle. I do recommend it. It is good for periods of time to bring in, but when you're doing keto, you definitely need to be watching your kidneys and you have to stay hydrated. That's where I see a lot of people go wrong, is they don't have the appropriate hydration when they go into a keto side of things, or ketosis. And they're dealing with a lot more issues with kidneys. And I've even seen some people that have taken it one step further, that are doing a little bit more keto and getting into a little bit more extreme exercise, more functional fitness, CrossFit, whatever you want to call it. And there's a higher predisposition for rhabdo.
For
So
what?
just think rhabdomyolysis.
What is that?
With the red blood cells coming from the kidneys, it's basically they're just blown up, and it could be life threatening.
Yeah. I heard Alberto Viola. He's written a bunch of books. Um, he's a shamanistic guy, but also a medical doctor and scientist, and he talks about keto as being really good for a beach body, but not really good for the long run, for the long term, and
I agree. I agree.
references the correlation between animal proteins and a lot of the major diseases that plague the societies of affluence, just like in the China study and Dr. Campbell's work there. Do you what is do you eat a lot of animal proteins? You look like you do.
I do eat a lot of animal proteins. I also have a very high hydration status. That my goal for my water intake a day is minimum. I drink at least minimum my body weight in ounces every day. Um, one half of my body weight. Sorry, one half of my body
Half.
weight in
Okay.
ounces. And I usually add electrolytes to that. So I do eat a lot of animal proteins, but I don't eat because I come from that genetic Irish heritage with meat and potatoes. So, cholesterol is not my best friend either. But with that said, I do keep my heavier animal proteins minimal,
Hmm.
twice a week, maybe. The rest of the time, it's clean sources in fish, so lean sources of protein, some chicken, some turkey. I don't really consume pork. I don't really mess with that too much because I'm a big fan of you are what you eat kind of thing. And I don't want anything to do with that.
Yeah. Thank you for that.
But as for the inflammation side of things, yeah, there is an inflammatory process that comes from heavier animal proteins. Um, there's a lot more of a process to break it down. So there's going to be a lot more outcome or reactive oxygen species that come from that. So um, the other part to that is so many people lack the appropriate enzymes to break those heavier proteins down. So if you're not taking a digestive enzyme, if you're not taking something that maybe has a protease in it, it might be, necessary to look deeper into a good quality digestive enzyme.
Yeah. So one more personal question for me, and then we'll open up, see if anyone else has anything. And the personal question is about protein and about metabolism of protein. I was diagnosed with cirrhosis of the liver. We talked about this on our planning call, and I did some research and decided to go keto for a
Okay.
minute, and that did not work out well for me. After about 2.5 months, I was considerably worse off, so I stopped and have been clawing back out of that hole ever since and feeling better. But what I don't understand is what is the role, and I wasn't eating animal protein. It was primarily plant-based.
Okay.
Well, with them, no, that's not true. Sorry, that's flagrantly not true. I was eating a lot of eggs and fish a few times a week.
Okay.
Um, and it hurt. It hurt me.
Mhm.
And I'm not clear on the role of the liver in metabolizing protein, but I assume that that had something to do with the backslide there.
hmm Yeah, that and what the liver's function is. I mean, the liver is a big detoxification center. The liver goes from phase one into phase two, basically breaking big particles down into small particles. But there's one other part that the liver does that a lot of people aren't aware of, and that's creating bile. Bile is a uh, internal, one of our fluids, if you will, and it should have the viscosity similar to like engine oil. So you've put engine oil in a car, it flows pretty good. But if you switch that bile out with molasses, now you got to squeeze the bottle. Well, if the liver is creating that, and by the time that it gets to its storage center, the gallbladder, that bile is molasses. Now, when that unit, the gallbladder liver unit contract, it can't get that bile out. So a lot of times when it can't get the bile out, either it wants to put calcium around it, aka stones, gallstones, or it's sludge that's coming from the gallbladder. But with the inflammation, because you're not able to get the bile moving and the liver is having that trouble with metabolizing, what's the body want to do? It's wanting to protect you. That's what the fatty depositions are. That's the body's way of saying, I'm going to protect this organ. I'm going to put a layer of fat around it. So a lot of times that's where it's coming from. So it's with you putting more keto in, which would not so much the protein, but the fats side of things for that, that would definitely make your liver gallbladder complex a little bit more angry.
Okay.
So I would say in your case, I would lean more towards, the paleo Mediterranean side of things. Keeping it that on that side, I think would be very good for you. And then for some of the movement of those fatty depositions, can you ever fully get rid of them? I would like to say yes, but I don't think that we can fully remove that. But if you were wanting to put in and stimulate a fat burning metabolism, you would add in something like an amino acid, acetyl-L-carnitine. Add that in for about 1,000 milligrams a day, and you'll start a fat burning metabolism, and that could also aid in some of that fatty deposition transfer.
Okay. Cool. Thank you.
Yeah.
Anyone else before we wrap up?
I got a couple. Sorry, I came a little late. Hi, everybody.
Hi, David. Welcome.
Thank you. Thank you. So quick question. For a person who comes to a functional medical doctor that is more on the healthier side, just looking for general wellness, wanting to be more better optimizing whatever it is they want to do, what is your general go-to treatment for that type of person? Something you'd look
Yeah.
you to what's it called, may suggest, supplementation, anything.
Yeah. So with that type of person that, they're relatively healthy, they're just really looking to, I want to make sure that I'm staying in this realm and I'm optimized where I'm at. And so I'd go down the road of looking at the foundational basic chemistry, looking at a comprehensive metabolic panel, a CBC, a thyroid panel, the cholesterol, and then looking at the hormones and looking at the bioavailabilities of those things and saying, okay, well, this is where you're at now. You may be great in your total form of testosterone, but we want to push your bioavailability up. We want to get you more access. We want to get you optimized. We want you to be at your peak performance, and that's where I would use that chemistry to really help optimize and help them, not only live the best life that they can, but now they're functioning at a high capacity. So I'd start there with the basic chemistry and then base off of that. And if there's any additional things that we would want to look at, whether it be looking at that true diagnostic testing that we were talking about with the epigenetics, what's your chronological versus biological age? And if there's a discrepancy, what do we need to do to get you so that you're actually younger biologically than you are chronologically? And that there have been cases that we've seen that too. So beyond that, and then understanding what you should and should not be putting into the diet, what is your complete roadmap of what does your body want, histamine wise, inflammation wise, through your diet. Um, and really that's where I would focus my major attention. Obviously, if there's other things that people are interested in, like what do my genetics look like? What do I have predispositions for? Can we start getting ahead of that? 100%. So even the most healthy person can still say, okay, well, I know that there's a genetic predisposition for this, so I'm going to preventatively get ahead of this. And I support that too. I had an 18-month-old uh, little girl come into my office once, and I'm like, well, this isn't really my wheelhouse, but she was 18 months old. She had a very rare um, condition of hyperlipidemia. So her cholesterol was through the roof, and she was having, the scales on her skin and so on and so forth. And, and so somebody that hasn't even had any kind of inflammation in their life still can use some help. So, yeah, thank you.
And I guess for my last question before we wrap it up, what makes a functional medicine doctor different from a regular internal medical provider, regular medical doc, PCP, in terms of
Yeah.
like lab tests, treating a patient, approach
Mhm.
towards certain, whatever it may be, certain treatment plans? What sets that apart, and how does it necessarily help a person more, or what things do they not benefit or do benefit off of from that type of care? Yeah.
Yeah. So the functional medicine doctor is, a doctor, and has the knowledge of a doctor, biochemistry, physiology, the function of the body. We're trained in that. But then as a functional medicine doctor, we have the ability to be the detective as well. So we can dig into what's deeper, what's the underlying cause. And, like we were talking about earlier, the difference between an allopathic doctor and a functional medicine doctor is the allopathic doctor is looking for what's wrong. You're coming in, what's wrong? We as functional medicine want to know why. Why is it wrong? So it's looking deeper into it. And that's where we go into our tool bag of all the different lab testings that we have access to. So based off of, understanding the history of the patient, their family history, but then also understanding what's happening currently in their life and lifestyles, including stress factors. Um, you then say, okay, here's our lab profiles that we want to jump off with. We're going to assess these. We're going to take those normal reference ranges that we get from LabCorp requests. Not saying that they're bad. Those are pathological ranges. We want to take those pathological ranges and break them down into an optimal, or something that I call a homeostatic range. And that's where we want to keep you, because that's how your body is going to function at its best. If we start going outside of that homeostatic range, then we say, okay, we're leading towards a pathology, either high or low. What do we need to do to prevent it from ever presenting as a pathology? So it's the why. Yeah.
Thanks, Doc.
You're welcome.
Right on. There are no other questions. I have one more thing that I would like to say to you all, and that is, if you would like to get in touch with Dr. Scott, his website is Functional Metabolics with an X, functionalmetabolics.com. If you would like to sign up to get notified regarding any of the upcoming shows that we have, you can do so at the Evolutionary Life. That's .life because .com is so last season. Sorry, Dr. Scott. The evolutionary.life, and go to the bottom of any page and put in your D to get, and you can get notified. Also, check out the YouTube channel, because that's where we put all of our other episodes. YouTube.com, of course, /at the evolutionary life is the handle, at the evolutionary life. And with that, I'm going to say, Dr. Scott, will you hang on the line for a little bit after we wrap up so we can have a little bit of a debrief? And with that, I would say thanks for being here, everyone. You make the
thank you very
show.
much.
Just no reason to have this without you. And we'll talk to you next time.